You've probably heard it 100 times: early detection saves lives. And for many years, that's been true. Routine checkups, annual screenings, and preventive tests were key tools in catching diseases before they took root. But what if I told you that after a certain age, some of these tests could do the opposite of what they promise? I know it sounds surprising, even unsettling, but for seniors over 70, some well-meaning health screenings may do more harm than good. Not because the tests themselves are flawed, but because our bodas and our priorities change as we age. In this video, we're going to talk openly about 5 health tests that may no longer be worth the risk once you reach your 70s. We'll explore what these tests are, why they're still commonly recommended, and the often overlooked dangers they carry for older adults. More importantly, we'll look at what smarter, safer alternatives exist today because you deserve healthcare that evolves with you, not against you. If you're in your 70s or beyond, or you care for someone who is, this conversation could help you avoid unnecessary stress, costly procedures, and even serious complications. Let's begin. Number 1. The overused PSA test. The PSA test, prostate-specific antigenes, a simple blood test that is often used to detect prostate cancer in men. Sounds harmless enough, right? But here's the problem. For men over 70, this test becomes a slippery slope. PSA levels can rise for many reasons that have nothing to do with cancer. A mild infection, an enlarged prostate, even riding a bike can push numbers up. And yet, a single elevated result often leads to a cascade of anxiety, biopsies, imaging, even surgery, all to detect cancers that more often than not grow so slowly they would never have caused harm in the man's natural lifetime. Worse yet, the treatments for prostate cancer can lead to lifelong side effects like incontinence and sexual dysfunction issues that can deeply impact quality of life. Many experts, including the U.S. Preventive Services Task Force, now advise against routine PSA screening in men over 70 who don't have symptoms. And for good reason. Your peace of mind is valuable, your dignity is priceless, and chasing a problem that may never affect you, that's not prevention, that's punishment. Number 2. The annual full-body scan illusion. There is something appealing about a machine that scans your entire body and promises to detect every hidden danger, like a high-tech crystal ball for your health. But full-body CT or MRI scans are often marketed more than medically recommended, especially to seniors. These scans can detect incidentalomas, odd little spots that look unusual but are completely harmless. The trouble is, once they're spotted, doctors are compelled to investigate. What follows? More scans, more tests, sometimes even biopsies or surgeries, all for something that was never going to hurt you. And let's not forget the radiation exposure from CT scans. At age 30, a little radiation might not mean much, but by 70 or 80, your body's ability to recover from that exposure is lower, and the risk of inducing new health problems goes up. These scans are rarely covered by insurance, often cost thousands out of pocket, and can start a wild goose chase that leaves you feeling more anxious, not less. If you are not showing symptoms and your doctor isn't seeing any clear reason there, that's little reason to put your body and mind through the roller coaster. Number 3. Routine bone density tests. In the frail elderly osteoporosis, screening is often done through a DEXA scan. For postmenopausal women, and sometimes men, it's a useful tool to prevent fractures. But here's where it gets tricky. After a certain age, especially in very frail or low mobility seniors, the benefit of detecting osteoporosis starts to fade, because treatment options, usually medications like esophageal irritation and unusual fractures, and these meds take years to show benefits. So if someone is already in their late 80s or 90s with mobility challenges or existing bone issues, discovering osteoporosis doesn't always change the outcome, but it can introduce new medications, side effects, and stress. It's not about ignoring bone health. It's about realistic goals. Is the goal to extend life or to prevent suffering? Sometimes those two don't align the way we expect. In many cases, simple safety measures like fall-proofing the home, using mobility aids, and balancing vitamin D do far more to protect seniors than one more test ever could. Number 4. Mammograms after 75. A hard conversation. Breast cancer screening has saved countless lives, but the story changes as women age into their mid-70s and beyond. Mammograms can still detect abnormalities, yes, but similar to the PSA story, they often detect very slow-growing tumors that would never have caused a problem in a woman's lifetime. And the process from detection to treatment, it's not simple. Biopsies, lumpectomies, radiation, these are not light procedures, especially for someone in their 70s or 80s. False positives are also more common in older women due to changes in breast tissue. That means more callbacks, more tests, and more sleepless nights, all for something that may not have mattered. Many major health organizations now suggest women over 75, especially those without symptoms or a high risk, can safely stop routine mammograms. That's not giving up on health. That's choosing peace, wisdom, and the right kind of care at the right time. Number 5. The catch-all annual blood work. You know the drill. You go in for your yearly checkup, and your doctor orders a long list of blood tests, cholesterol, liver function, kidney function, thyroid, vitamin levels, glucose, and on. But here's the thing. Routine blood work in healthy seniors can sometimes create more confusion than clarity. A number might be slightly off. Your sodium is a little low. Your creatinine is a touch high. Your vitamin D isn't where they want it. And suddenly you're on supplements, redoing labs, or even seeing specialists. All for results that may reflect natural aging more than disease. Doctors are now realizing that what's normal for a 40-year-old may not be normal for someone at 75 or 80. And chasing numbers to fit a younger standard can actually lead to overtreatment. Unless you're remanaging a known condition or showing symptoms, it may be smarter to reduce how often you get routine blood work. Instead, focus on how you feel, how you function, and what your body is telling you. You are more than a number on a lab report. In closing, trust the wisdom of your years. The idea that more testing equals better health is deeply ingrained in our culture. But as we grow older, wisdom teaches us something different. After 70, good healthcare isn't about chasing every abnormality. It's about honoring your quality of life. It's about minimizing harm. It's about thoughtful choices, not automatic ones. That doesn't mean ignoring problems. It means asking better questions. Is this test going to change how we treat me? Will it improve my day-to-day life? Or will it introduce fear, complexity, and risk? Speak openly with your doctor. Seek out second opinions. Ask whether a test is truly necessary for you at your stage of life. Because health isn't just about surviving longer. It's about living better. You've earned the right to a calmer, wiser approach to care. And that starts with knowing when to say yes and when to confidently say no. Thank you. Thank you for watching. And most of all, thank you for valuing your health in a way that respects your years, your experience, and your voice.